Namaskar and welcome to another episode of Welcon. As you know, this initiative is for public health, awareness, prevention, cure, you name it. These are the questions that you can put across to our experts that we have on our panel. Today, I have Dr. Harikumar Nair with us, and he's here from Kochi. So, before I go into a deeper intro of yours, I would like to know something about yourself.
Thank you for inviting me for this program. I have been in liver and digestive care with a 24 years of practice.
Oh.
And hepatology, liver, of course, is my passion and focus. Did work as a transplant hepatologist to begin with, and then migrated into hepatic hemodynamics, which is basically liver pressure studies. And currently, I am into community hepatology quite a lot, primarily because the solution for the problems are all at grassroots level. Community liver care is much more important than anything.
Yeah, I guess that's where we come in, and that's what we have been trying to do is actually bridge the gap. Like he's saying, it starts from the grassroots level of the community. And we are very grateful to you, sir, for joining us today and sharing your knowledge of nearly 24 years plus. Wow, that's nice. So, sir, we have got specific questions from our viewers, and we collate it, and we would like you to answer a few questions. So, how much alcohol is safe for drinking?
Well, see, this is a very this question I keep hearing from public as well as from in scientific forums as well. Many guideline authorities which bring out guidelines have quoted and stated that X number of standard drinks for women and Y number of standard drinks for men. When you look at these guidelines, we should realize that these are all not healthy drinking limits. These are all limits set for less harming, alcohol quantity. So, needless to say, every drop of alcohol affects your body. Many people think it is liver that is getting primarily affected. Partly true. In fact, it affects most of the organ systems in the body. The heart is getting involved, the lung is getting involved, kidneys as well get involved, skin as well as hair also gets involved. So, answer to your question in just, there is no safe limit or there's no, scientifically speaking, there is no healthy drinking limit. What you can all do, what you all can aim at is to have a drinking which is probably less harming or less injury.
So basically, it's a myth that a one glass of red wine is good for you, or one drink off and on is okay for you. Is it a myth?
Of course it is.
Okay.
But then this is not a true lie. This is kind of a half truth. I would explain that. Red wine has got many molecules which are good for health. They are collectively known as polyphenols, and a particular molecule called Resveratol is supposed to be very good for health. It has got anti-cancer property, antioxidant properties. But then logically speaking, if you are aiming at Resveratol quantity sufficient enough to improve your health, then you will have to drink gallons of wine. Wine is 14% alcohol, and when you aim at your Resveratol dose to improve your anti-aging and anti-cancer, you're drinking quite a lot of alcohol molecules as well, which would be doing more harm.
So I think the viewers would want to know, or rather it is an important point that Sir has brought up, that yes, there are certain good qualities on it, but the amount that you would need to drink is harmful because it also has alcohol content.
In it. If you have a capsule which resveratrol, which the red wine has, of course it's going to improve your health, but then the add-on factor, which is alcohol, is going to harm you. So in nutshell, by drinking wine, you're not going to improve your health. By drinking wine, you're drinking it for the sake of that, for the feeling of having a drink to relax. That is the purpose. It is not to improve your health.
Okay, I think that is a very important aspect, which many of us don't know. The underlying problems that it could cause. Yes, like Sir said, that it's okay to enjoy a drink off and on, but not for drinking it thinking that it's a benefit to the body in
Absolutely.
any way.
Absolutely.
So, sir, correlating to this, how does alcohol really affect our liver?
Yeah. So liver is the factory which deals with many other poisons, as well as what all we ingest or drink as food material or as medicines. Everything has to go through liver, and this factory cleans it up. Once the purpose of a medical molecule is done, then it has to go out of the body. This is done by liver. Similarly, when you drink alcohol, the alcohol molecule goes into the liver, and some enzymes, some chemicals work on the alcohol dehydrogenase, aldehyde dehydrogenase. These are enzymes which act on the alcohol molecule and then chucks it out of the body. In this process, unfortunately, if the quantity and the frequency of alcohol intake is more, then the liver suffers. The liver cells won't cope up, they die out, and some of the liver cells get swollen up. This is called inflammation or alcoholic hepatitis. And when the liver cells die out, scar tissue forms on top of that. This is called fibrosis. And in the long run, let's say 10 or 20 years of drinking, the fibrosis would get added on and ultimately will result in
Cancer.
liver cirrhosis and liver cancer.
Okay, okay. So, sir, also many times I've seen, like, suppose someone has had a bypass and they come out and they feel, oh, my heart is as young as, new. And then they forget about what pain or what they suffered.
Right.
And they will drink thinking, oh, the heart is good. But, and specifically if you take a case of a diabetic who's had a, bypass and then indulges in drinking, how bad is that?
This would be highly detrimental in the sense someone has ended up in a bypass surgery because his blood vessels in his heart were clogged, and this clogging mechanisms are contributed by metabolic ill health. Of course, alcoholism is also part of it. So he has undergone a major surgery to open up his blood vessels, and going back to drinking would be like inviting the same trouble again. Same problem happens with liver transplant as well.
Okay.
You give a patient a new liver, and now the person thinks that I've got a pristine new liver. I can restart drinking. This is something which the public needs to be aware of. Once a major organ change, a surgeon has done a change in his organ, either replace the organ or doing a plumbing work like in the bypass surgery, which means your lifestyle in the past was wrong. Better that you correct it.
So overall, whether it is liver health or overall health, I think lifestyle is a very important aspect to good health.
Absolutely. If you look at the entire, liver morbidity, a very small percentage happens to be due to genetics. The genetic diseases would be very less. More than 90% is lifestyle disorder.
Oh.
And of course, infections contribute, but beyond infections, it is not at all genetics, it is lifestyle disorder. Whether it be alcoholic fatty liver disease or non-alcoholic fatty liver disease, whereby you eat a lot, but then you don't exercise to a meaningful level and you end up having a lot of fat in your liver. So both these tracks are lifestyle disorder. Big chunk of it is lifestyle, not genetics.
I think many people also, try to get away, or they console themselves saying that it's a genetic issue. But actually, what you're mentioning here is it's majorly a lifestyle issue, not a genetic issue.
Absolutely. That's our ego defense mechanism, right? We want to put the blame on someone else.
Yeah, our mind is very smart.
Yeah, our mind is smart. So put the blame on parents.
Yes.
The ones who gave us the DNA.
Yeah.
The genetics.
Very true. So what would be the signs of alcohol-related liver disease that people should look out for?
So this question is very important because you can conceptualize alcoholic liver disease. Imagine someone is having cirrhosis liver, diagnosed to have cirrhosis liver today. He has been having the damage going on in his liver for last 20 or 30 years.
Oh my God.
He becomes symptomatic, or he gets some problems either in terms of waterlogging or bringing out blood, his muscles get weak. All those happen only towards the fag end of this entire pathological process, spanning over 30 years. So when that happens, the symptoms are like, either a leg swelling to begin with, or muscle cramps, or sleep disturbance. He may not get a good sleep in the night, but then he feels like dozing off in the daytime. So these are signs and symptoms which should warn that you're having a cirrhosis of liver, but then it's too advanced stage to comment on. The primary damage happening in the silent phase is the time when you can reverse it, but unfortunately there are no symptoms in the silent phase spanning over 20 years. So screening tests are the answer for this. If you could identify in the silent phase, then you can reverse the liver and go back to normalcy. But if you're identifying the disease when you start getting some symptoms like waterlogging, then it's not possible to reverse.
Reverse it. Yeah, because even in our earlier talks that we have had, what we have discovered is that when we actually see the symptoms, it's already too late. You've already got a disease in place.
Yes, yes. The saying would be, to turn yellow is too late.
So, my dear friends, you can imagine that you've already abused your body for, say, 2 decades or so before you even come to know that your liver or maybe any other disease that you would have really shows up. I think diabetes is also of a similar kind. It shows up only after 10 years of abuse to the body.
True, very true.
Okay. So, sir, can occasional binge drinking harm our liver?
So, to answer this question, we need to be very clear about what binge drinking is. Binge drinking is having quite a lot of huge amounts of alcohol in a very short span of time. In fact, scientific studies have clearly shown that binge drinking is extremely harmful, in the sense, if someone is having a very less amount of alcohol on a regular basis versus someone is engaging in binge drinking, the first person is going to get away with it. Why? Because liver has got regenerative capacity. You're having a minimal amount of alcohol on a regular basis, but then liver gets sufficient time to bring in new cells. While in binge drinking, large quantities of alcohol in a short span of time, liver doesn't have enough time to come up with new cells. So regenerative capacity cannot help the person who is drinking in the case of binge drinking, while regular small-scale drinking, liver can support the person with regenerative capacity. So to answer to that question, binge drinking is something which is extremely harmful.
That's another eye-opener,
It is.
Yeah, because we all think that, we don't drink, and once in a while, it's all right to binge drinking. Whereas, I'm really aghast to even know that. I myself was not aware, or rather I would feel ignorant about the fact that binge drinking is more harmful than a little alcohol regularly. So, my dear friends, look out for that. So, how long does it take for a liver to recover after drinking alcohol?
This actually, partly we handled this in the previous question, whereby a very small dose of alcohol on a regular basis, liver would keep regenerating. Day in and day out, it will regenerate. Okay. But if you're talking about a binge drinking and a massive liver injury, it can take longer time. It may not even regenerate. Some of them end up with acute liver failure as well. So regeneration depends on how much quantity you take, and it's again binge drinking can in fact end up in a sudden death. Reason being, the binging. Binging doesn't mean having alcohol occasionally. Binging means it is high amount in a short span. It affects the liver. Liver doesn't regenerate, which we mentioned. It affects the heart. It affects the rhythm of the heart, and there is something called holiday heart syndrome. Binging affecting the heart wiring gets damaged. The rhythm doesn't happen properly, and the patient is found dead, and the person is found dead in a nice resort where he was enjoying a weekend.
Gosh,
holiday heart
my
syndrome.
my heart
Hope
is
I'm not
missing.
scaring you, but
No,
then this
no,
is passing on scientific facts.
yeah, my heart is missing a beat because okay, we have seen that people going at parties or things like that, and suddenly they have a massive heart
Heart
attack or
attack.
something, and they pass away, not realizing the fact that it's actually due to
Alcohol.
alcohol intake into the body.
True.
So, my dear friends, again, yet another very important point. Dr. Nair has been coming up with very insightful details for you all. I hope you all are taking it in seriously and would look after yourselves. Going further, sir, what is the relationship between alcohol and liver cirrhosis? Again, it's a part of the similar kind of a question. And after you have been diagnosed with cirrhosis, is it reversible?
Yeah, we had partly again handled this in the
Yeah,
previous
yeah.
question. Once you reach the stage of liver cirrhosis, then full reversal may not be possible. Although there are some data, some research pointing towards fibroregression, which means a scar tissue which has formed in the liver to ultimately get you into liver cirrhosis status. Part of it at least can resolve. So there is some reduction in the scar tissue amount possible, but then once you reach liver cirrhosis, the structure of the liver is totally deranged, and you cannot fully go back to a normal liver. Irreversible it
So,
is.
what would be its cure?
Well, once someone who has been diagnosed as liver cirrhosis would be initially put on medical management, where the cornerstone again is stopping the insult, which is alcohol, and then put him on medications to reduce the liver pressure, allow liver supportive medications, allow the liver to regenerate. And over years, what would happen is at some point the liver function would start dipping. And from this point, gradual worsening would happen, and ultimately this person has to undergo a liver
Transplant.
transplantation.
Okay, okay. And so, is there any other insight that you would like to share which I may not have touched today?
Well, we have, I mean, I'm worried whether we have given a very scary depiction of alcohol, but then, well, I mean, we haven't, these are facts which need to be conveyed to the public. One point which probably we missed out in today's discussion is alcohol is a poison or is a damaging agent to the liver. This is a popular concept. In fact, it involves most organ systems in human body. We did mention about holiday heart syndrome, heart attacks happening, so it can involve the heart. It can involve the brain. It can result in stroke. Dehydration during a massive binge drinking in a festive environment can result in a stroke. It can result in demyelination, which is basically damage happening to the covering of the nerve cells. It can involve the kidneys. It can result in something called nephropathy. It can involve the skin. Many people think a small peg a day can keep you young. The truth is, alcohol in fact damage the tissue just beneath the skin. The same thing which keeps your skin stiff and young, collagen, and regular alcohol and increased alcohol intake would make you look older, not younger. So, in nutshell, every possible organ in the body is getting affected by alcohol, not just liver.
Actually, that was going to be my showstopper question, which you touched. And just to reiterate what Sir has said, is that commonly people think alcohol is only related to getting liver diseases. But here, Dr. Nair just mentioned to us that alcohol has many side effects and it affects many parts of the body, not only its liver, right, sir?
That's right.
So, if we have to sign off for today, what would your five takeaways be for the public, for the people?
Regarding alcohol, see, there is no point in saying that alcohol is bad, it's a poison and it has to be stopped fully. There are, many states in India have banned alcohol, including Kerala, but it didn't work out. So it didn't work out. In 2014, alcohol was banned in Kerala.
Oh.
So what happened was again, this pseudo liquors, the fake stuff
Okay.
came into the market, and non-alcoholic many drug abuse and all started coming up. So banning is not the
Answer to
answer.
it.
The answer to this is probably a change in the culture of drinking.
Okay.
You need to know what you are dealing with, what kind of, what the amount of alcohol which is going to damage you, and to relax over a weekend or once in a while, maybe a month or so, if you're drinking, you have to know your limits. The amount where you reach that phase of relaxation, you need to identify. That is one. Second, as I mentioned, over many, many years, silently this damage progresses. So it is prudent to have a screening checkup, maybe annually, for those who have crossed 40 years, can undergo screening blood work, an ultrasound of your liver, as well as something called fibroscan.
Scan. Yes.
So this is yet another one. Third one would be, we need to work in the campuses, because we did mention about drinking culture. The change has to happen nip at the bud in the schools, in high schools as well as in campuses. So awareness programs should be conducted in the campuses. These are the rough, messages I would like to convey.
Here in Kochi, on a drive for Welcon, we've had many school education here,
Yeah.
because, like Sir said, we should nip it at the bud. So the children, the students need to be educated about its reverse negative effects. We've had a public forum here at this conference here in Kochi, and we gave many free giveaways. One of them was the important fibroscan, which Sir said. We did free fibroscan for the people attending the convention. Our main motto out here is to encourage you all to take health with enthusiasm, rather than taking it in a negative form. I have mostly seen people, when they talk about looking after their health or talking about doctors, there's such a serious mode to it. I feel that if you enjoy the process of being healthy, making lifestyle changes, it'll take you a long way. And I think it'll sustain you taking steps to being healthy. And I truly believe it's important to be. What would you believe, sir? Happy to be healthy or healthy to be happy?
Well, you brought out the point very clearly. I would say the public attitude is, that's primarily because doctors and healthcare sector, the interface happen with the public only when they are ill. They come with a disease, they're dependent on you, and they're getting crippled. This is the time when the interaction happen. Ideal interface should be wellness. So if you could focus from illness to wellness, then the public attitude also might change. Interact with them when they're well, and then prevent them getting ill.
Yeah, I think if this aspect everyone understands, and rather than looking to go to a doctor only when you are ill, is already too late.
Yeah, that's right.
And
Which is late, and I mean, the person is suffering.
yeah,
So it's a negativity factor which works there in the doctor-patient relationship. While
correct.
if you could just prepone it in the wellness stage, it's a positive interaction, it's a positive vibe. So illness to wellness, that should be the aim.
Wow. Thank you so much, Dr. Nair. Dr. Nair is currently working as a senior consultant hepatologist. I get tongue-tied with these big words sometimes, at the Liver and Digestive Care Ernakulam Medical Center, Kochi, Kerala. If you all have any questions regarding alcohol and liver, or any other health or wellness questions, kindly put it across to us. We'll have a link with email ID or in the chat box below. You would connect with us. We will connect with doctors, and they will get back with their answers to you. How does that sound?
Perfect. Sounds good.
I think we are blessed to be associated with such doctors who are taking out time from their own life to share their knowledge, so that everyone else can also embark on a health and wellness path. Thank you so much. Thank you so much, sir, for
Thank
being
you.
with us.